Following on from the discussion we've had this morning, I think it's very apparent that we need to take a holistic approach to how we actually view this and actually think about the wider thing outside just the hospitals, etc. We need to think about how it links in with society as a whole. I think the biggest challenge is the fact that there's a massive estate there of quite old buildings, historic buildings, that will be challenged from the fabric not being sufficient to actually accommodate the updated changes that would be needed to actually facilitate decarbonisation. So it's going to be a balance between equipment and also retrofitting of the fabric of the buildings.
We know the climate is changing, and that's why the NHS has brought in our net zero building standard, which is compulsory for all new buildings going forward and all major refurbishments. But also we've asked all of our ICSs in the Yorkshire area to come up with an infrastructure strategy. So across West Yorkshire, South Yorkshire and Humber and North Yorkshire, they're currently writing an infrastructure strategy, and obviously thinking about climate adaptation is going to be key to those infrastructure strategies.
When we look at decarbonising, we need to be thinking about the type of service and the clinical service as well, and how we match the clinical practice as well in decarbonising. So it's a massive challenge. It's a collaborative effort. So the NHS and the construction industry, consultants have all got to collaborate to actually drive down to net zero or decarbonise the estate. Otherwise, it's not going to happen.
What I'd really love to see happening is real focus on collaboration between all parts of the healthcare sector. So bringing community provision, social care, primary care, secondary care, and being able to work together collaboratively to provide, sustainable buildings, delivering healthcare to all levels of society. I think that's a really big challenge, but we are seeing pockets of collaboration happening.
Particularly from a flooding point of view, for example, that's become more and more prevalent, how you deal with those situations. But also then, in terms of the building fabric, temperatures going up, trying to cool buildings, do you do it naturally? Do you do it in other ways? Do you have to use a combination? Do you just mechanically vent spaces and then recycle the energy? And do you try and minimise the amount of energy going into buildings? And, solar energy at certain times of day on certain facades is a real killer, but there again, it could be also used very, very fundamentally by using energy to be stored as a heat sink in a building and redistributed as and when. So it's becoming more and more sophisticated in terms of the response that you need to bring.
I think it's not just about how we replace buildings to keep services the same, it's how do we fundamentally change how people access services, where they access services from, what we're using our hospital buildings in particular for, and our wider community estate. It's turning it on its head and decentralising the hospital.
The replacement of fossil fuel heating with electric-led heating costs a lot more than like-for-like replacements, and revenue costs go up as well. So that's where the NHS has been really fortunate with public sector decarbonisation scheme grants. To date, NHS trusts have received over £800 million worth of funds for decarbonisation. That goes a lot of the way towards electric-led heating, but also helps with energy efficiency, installation of renewable electricity and building fabric improvements. So it's making a real difference to projects at the moment for the retained estate.
I think my biggest takeaway from the discussion today is that the NHS and the industry that supports it understands the degree of the challenge relating to sustainability, but there needs to be much more focus on wider collaboration at a local, regional and national level to bring projects forward in good time.
I think one of the major challenges is the funding available to actually decarbonise the estate, and having the technology and the industry enabled to actually deliver that decarbonisation. So I think it's a really massive challenge.